Hi there, you're all welcome to this weekly edition of the program Your Health, aired on Equinoxe Radio, television and on Facebook. Reason why? It is called a multimedia program. Today we are going to be looking at glaucoma. Ophthalmologists in Cameroon say glaucoma affects 10 out of 100 people aged 40 and above. Health experts blame the very high rate of blindness among glaucoma patients in Cameroon on negligence. Last week we were discussing on cataract, but due to poor connection we were unable to answer some very pertinent questions which some people had to send their messages, and I noticed due to that poor connection we were unable to answer some of those questions. But today it's going to be an opportunity for you to ask those questions, not just on cataract but equally on glaucoma. Let's go on the short break. I will be right back. Welcome back. On the line is Dr. Henry Kumbi, an ophthalmologist who equally doubles as the Chief Executive Officer of Migrabi ICO Cameroon Eye Institute located in Yaoundé. It is a pleasure having you on the program, Doctor. Hello, Doctor. Hello? Hello, Doctor.
Yes, I'm listening.
It is a pleasure having you on the program.
Thank you very much, Immaculate, for inviting me on your show.
Okay. Last week, due to poor connection, we were unable to answer a very pertinent question on cataract, which was prevention. So before we dive into glaucoma, I want you to first of all tell us, how can we possibly prevent cataract?
Yes, thank you very much, Immaculate. I think with cataract, if we live long enough, if God blesses us with long life, then the chances that we will have cataracts are very high, because we know that 80% of people who undergo cataract surgery are aged 50 and above. That said, there are a couple of measures that we can take to reduce the chances of developing visually significant cataract. We know that one of the major risk factors is exposure to ultraviolet radiation, simply said, sunlight. And so wearing good quality sunglasses which filter 100% of ultraviolet light can help reduce, the risk of developing visually significant cataract. Also, there are some lifestyle changes. There are some like using some over-the-counter eye drops. It's not because you went to see an ophthalmologist 6 months ago, or your son went to see an ophthalmologist, that you're going to use the same eye drop without clearance from the ophthalmologist, because some of this medication, one of the side effects could be that they encourage the development of cataract. And like I mentioned last week, we have some cosmetics, people who want to lighten their skin. Some of those cosmetics contain corticosteroids, which can cause irreversible blindness, be it from cataract or glaucoma. And then, of course, I mentioned children, that children can develop cataract from trauma, from injury. We have to ensure that in schools and at home that children refrain from dangerous games, play with projectiles, or any form of activity that could result in injury to the eye. So these are some of the measures that can be taken.
Okay, now, if you're just joining us on the program, then know you're watching the program Your Health, and we are Reporting right live here in the economic capital Douala, precisely in Accra, and I am receiving an ophthalmologist, Dr. Henry Kumbi. He is an ophthalmologist who doubles as the Chief Executive Officer of Migrabi ICO, Cameroon Eye Institute, located in Yaoundé. And last week, due to poor connections, we were unable to answer some very pertinent questions on cataract, reason why we had to come back on that particular topic before we end the topic. But this time around, we are going to be looking at who is most likely to develop glaucoma. Glaucoma is equally another eye problem, and which, if it's not treated, it could result to blindness. And according to statistics, 10 out of 100 people in Cameroon are suffering with glaucoma, and it is people or health experts have said the high rate or the high prevalence is due to negligence, because people don't go for early diagnosis for doctors to be able to tell if it can be treated or not. The reason why it is very important whenever you have any eye issue or you start developing any, let's say, any difficulty when it comes to vision, or you're having blur vision, it's very important for you to go to the hospital and get yourself checked. Don't just do self-medication. Self-medication is very bad, and we are trying to get to Dr. Ebong Henry, who is back online. Hello, doctor. Hello?
Yes, hello.
I guess the connection is trying to play tricks with us.
Yes.
Okay. So now I want to know, is there any similarity between cataract and glaucoma?
Well, cataract and glaucoma, in terms of similarity, I wouldn't say. I think the main similarity they have is that they are the two main causes of blindness and vision impairment in Cameroon.
Okay.
Cataract accounts for 45% of blindness, while glaucoma accounts for about 12%. So this is very big.
So now, what are the signs and symptoms of glaucoma?
Very good question. I think one of the things with glaucoma, and that's in fact that's the reason why some people call it the sneak thief of sight, is that the type of glaucoma that we find commonly in Cameroon, in Central Africa, is called primary open-angle glaucoma. And this type of glaucoma is painless. You can have it for years without you noticing, but it steals your sight. It makes you blind gradually. And it's usually, in the final stages of the disease that perhaps accidentally you realize that one eye is completely blind. So it's asymptomatic, generally.
So now you just talk about angle closure. What about secondary glaucoma and normal tension glaucoma? What about pigmentary glaucoma? What makes the difference between these different types of glaucoma? How different are they?
Yeah, very good question. I mean, if I want to explain all these types of glaucoma, it's going to take a long time.
Okay.
The bottom line with glaucoma is that glaucoma is a disease of imbalance. Mm-hmm. What I'm trying to say is that inside the eye, within 24 hours, there's a certain amount of fluid which is produced in the eye, and there's a certain amount of fluid which is drained out of the eye. When there is an imbalance, when you have more fluid being produced inside the eye than the eye can drain, the pressure inside the eye builds up. And when that happens, it causes damage to the optic nerve. It's just like you wearing a new pair of shoes which is a bit tight and you try to walk. After some time, you realize that you have some blisters because the shoes have bruised your foot. And that's basically what happens. And in an internal bruising of the optic nerve head, which is damaged. That is what is common to all the glaucomas, be it pigmentary glaucoma, normal tension glaucoma, or primary open-angle glaucoma. So angle closure glaucoma simply means that, the drainage angle is blocked by some structure, such as the iris itself, whereas in open-angle glaucoma, the drainage angle is not blocked, but the facility with which the fluid leaves the eye is reduced for some reasons. And of course, pigmentary glaucoma simply means that, the iris pigment, the brown, what gives us the brown color, coloration of our eyes, that some of that pigment is released, and that pigment clogs up the drainage angle, the drainage structures, and as a result, the pressure builds up. So you have more intraocular fluid being produced than the eye can drain, can evacuate.
Okay, for those who love to participate in the program, you can call us through the following numbers: 655-511111 or 242-642980. Back to you, Dr. Henry. So now, I want to know, is glaucoma diagnosed the same way as cataract?
Now, the diagnosis of glaucoma, for you to know that you have glaucoma, there are two ways. Similar, I mean, you can use similar approaches to that of trying to find out if you have glaucoma, cataract or not. The first one is the simplest, is that you can stand in your living room in front of a calendar, an almanac or whatever, at a distance of about 3 to 5 meters, and you close one eye with the palm of your hand without putting much pressure on the eye, and then you try to see if you can see very well. And you do the same thing with the other eye. If you notice any difference between the two eyes, it means that there could be something going on, and you have to see.
I think we are facing some situations with connection, but I guess our technician is trying so hard to call back our doctor so he can tell us or edify us more on glaucoma. And he was telling us about, before the call just stopped, he was talking how we can diagnose glaucoma, and he was explaining what we can do in order to detect if we are having some issues as far as glaucoma is concerned. And as I rightly said at the beginning of the program, we are receiving Dr. Henry Kumbi. He is an ophthalmologist and Chief Executive Officer of the Migrabi Eye Institute. We'll be getting to him in just a few seconds because our technician is trying to call him. I don't know what's really wrong, but the connection this time around has been very bad. That's since last week when we were talking about cataract. But I guess with God being on our side, we will be getting back to Dr. Henry Kumbi. So if you would love to participate in the program, you can just start calling. So he's going to be answering the questions subsequently. And the numbers are 655-511111 or 242-642980. It will be an opportunity for you to learn a lot of things when it comes to glaucoma. Have you been suffering with glaucoma and you don't know what to do? I think today it's going to be an opportunity for you to learn something new, and why not how to better prevent the disease from affecting you. So our technician is on the line with Dr. Henry Kumbi. Hello, doctor. We are finding it really hard to get to Dr. Kumbi, who is an ophthalmologist in Yaoundé. But I think we are putting more effort to get to our doctor, and I think in less than a few seconds we'll be getting to him. But it should, however, be recalled, as I earlier said at the beginning of the program, they say 10 out of 100 people are suffering with glaucoma in Cameroon. That's really much to just say 10. And if this 10 do not take care, it can lead to blindness. So now, what can we do to avoid blindness? Because it's really hard to be blind. It's really a difficult situation. You can't help yourself. But what measures are you taking in order to prevent such a situation? That's what we are trying to look at. That's what we are trying to prevent. Some people are born naturally with blindness, but that is, they didn't wish for it. It just happened. But what if you can prevent such a situation from happening? Why not take the chance? Why not listen to this advice given to us by Dr. Henry Kumbi? We are really struggling hard to get to him so we can continue with your weekly program known as You're in Health, which is currently being aired live on radio 93.0 FM and on Facebook on Equinoxe TV and on TV exactly, which is Equinoxe TV. We won't be able to have Dr. Kumbi. That's what we are getting from our technician, and I'm very sorry it's due to poor connection, but I pray our next guest the connection will be far more better than today. And that's all we had for you on this edition of the program Uni Health at on Equinoxe Radio Multimedia. I had Dr. Ebong Henry, an ophthalmologist, as guest. And for presentation, I am Immaculate Fogwe. For technical assistance, I got it from Raphael Dupanda. Stay blessed in the company of more programs on Equinoxe Radio Multimedia. So long.